Welcome to the Body Shop Physical Therapy. I'm Dr. Catherine Price. I'm a physical therapist, and in this video, I'm going to go over a systematic review article that was published in March of 2024 looking at surgical versus conservative management of an ACL rupture. An ACL is an anterior cruciate ligament. It's one of the four major ligaments of the knee. And before I begin, I want to speak a word of life from Proverbs 15:1. A gentle answer turns away wrath, but a harsh word stirs up anger. So I am a physical therapist that likes to focus on helping folks avoid surgery if possible. And it's been common if you get a complete tear in the anterior cruciate ligament in the knee, the common intervention and strategy is to go in and surgically repair this ligament. And we don't and haven't had good evidence of what the outcomes are of conservative versus surgical. And in fact, for a long time and in school, what I learned is if you do not have it repaired and you have an unstable knee, it leads to osteoarthritis. So I just want to present what some of the recent findings are so that if you are considering one or the other, you have this information or you can find it. I will put the link in the below. So if you want to read the article, please do. So this article compiled over 2,000 articles considered, and 5 were chosen with a total of 462 individuals or patients that were studied or looked at in these different articles. So there are 5 articles that were reviewed, and the function, the return to sport, swelling, and then osteoarthritis was looked at, and there was research articles indicating the differences at 2 and 5 years and 11 years. And I want to share some of those findings because I find it quite interesting, and decision making is huge. So when you're going to the doctor and let's say you've had a complete ACL tear and let's say you're not having any pain, what is your rationale for having the surgery and what does the literature show? And that's what I want to share with you. So can a complete ACL rupture be managed? The answer is yes, it's possible. Also, can you have successful outcomes with surgical repair? Yes, there has been shown to be positive results when having a repair from a complete tear. So let's go over some of the findings and just outcomes there. So first of all, your ACL, it is the only major ligament that's preventing internal rotation in the knee. So when your knee is straight, it's going to prevent the tibia, that bottom part of the leg, from shifting forward. So it's doing the same thing that your hamstrings do. So that ligament is going to keep the knee stable and keep that tibia from shifting forward. It prevents internal rotation. So if you're doing a sport where there's a lot of pivoting, when you go into a squat, as your knee bends, that tibia internally rotates. That is where you're putting stress on that ligament. So if you're in a deep squat and that is a weak link, that can be a time of rupture. So it is required to have stability in the knee. So what the literature does show is that if you have that ligament repaired, if it's a complete tear, that you will have more stability in the knee. So that's one of the benefits. Now, if you're going to conservatively manage it, usually it's going to be done with a hinged brace, and that's going to protect you from that shifting of the tibia. And that can be a successful treatment if you're going to go back and you're going to play a sport or you're going to do some of that pivoting movement. And so the ACL, if it is injured, it's going to be graded, a grade 1, 2, or a 3 sprain. A grade 1 sprain is going to be your typical, I strain the fibers and have a little bit of swelling possibly. It's just painful, but no change in stability. A grade 2, you're going to have what you consider a partial tear, and you may have some instability, but nothing that cannot be managed conservatively. Grade 3, the ligament's gone, and there's instability. Surgery usually is going to be an option at that point. However, the question is it better to conservatively manage it or to surgically manage it? So one of the things that was found with this systematic review is that the return to sport was longer if you had surgery. So if you do have surgery, it's going to be a rehab process and it's going to be a longer time to return to sport. However, if you do return to your sport, which you can do it both surgically or conservatively, the length of time of remaining in that sport was longer if it was surgically repaired. So if you're a high-level athlete and you've got a complete tear and you're doing a sport where it's going to require the pivoting of that knee, and even in contact sports, so you've got your football, your soccer, your basketball, those types of sports, if you have an unstable knee, you're going to really need to very be mindful and use strategies that are going to keep that knee incredibly strong and stable, the outcomes to remaining in your sport with more longevity may be to go in and have it repaired. So that's with your high-level athletes. With the studies that there were not high-level athletes, there really wasn't any difference in the outcomes, in the functionality of the knee, so to speak, between the conservative management and the surgical. Now, there was more stability in the surgically repair patients with surgical repairs, but there wasn't so much a difference in the quality of life, whether it was conservative or surgically managed. What was interesting, though, at 11 years, there was only one study that showed the incidence of osteoarthritis was actually more in the surgical group. And for me, that is something I'm going to pay attention to, because when I look at someone and what their goals are and what they want to do, I try to incorporate and consider what and how is this going to impact a person long term. So when you go into and you have your knee surgically repaired or intervene in a surgical manner, there tends to be, based on the literature, more an incidence of osteoarthritis. But that is not a huge difference, but that was one study showing more incidence of osteoarthritis at 11 years. At the 2 and the 5 year mark, early on, you're not going to see it. You don't have really those times for the degenerative changes that you may see later on. So you may, if you go in, you have the surgery, you may return to your sport, stay in your sport longer, have some of that benefit there. But then thinking about years later, decades later, what the outcome is, there's not enough research so far to really make that conclusion that it will promote osteoarthritis more in the surgical repair versus the conservative management. But what we are seeing is that the surgery is not preventing the osteoarthritis later on. So that is something to consider when you are thinking about a surgical repair of the ACL and a complete rupture. So those are some of the findings in this systematic review. And what I have read in other literature is if you do have an ACL rupture, and if you do rupture it, 50% of the time, there's other structures involved. Not always the case. If it's a clean ACL rupture, and that is what this systematic review was looking at, just the ACL rupture. If you've got other structures involved, that kind of changes things as well. And some of the other literature that I have read is that if you do rupture that ACL and you do conservatively manage it, you just have more of a risk of then injuring another part of the knee, like the meniscus, because you have that instability and a chance of hurting another structure in the knee. So that is what I've looked. So when you are considering, am I going to conservatively manage this or not, you also want to take into account, well, I may, because of the instability, put myself at risk of injuring other areas. However, if I do this and do this mindfully, and I'm not going back and doing a lot of pivoting, twisting, and stressing my knee in a risky manner, so to speak, then you can possibly avoid the osteoarthritic changes that come from the result of having that surgical intervention later on. So it's really just weighing, what is it that you want and what are your goals, and just thinking about your long-term health. The other interesting is just also keeping in mind post-surgical swelling. Sometimes it does not go down and can stay into the knee over a year. And that has an impact on the whole neuromuscular skeletal system. So keeping that in mind as well. So just wanted to put that out there as far as the recent literature on conservative versus surgical management of an anterior cruciate ligament rupture. I'm always wondering, what is the best approach and protocol? And again, one of my goals as a therapist is to help folks avoid surgery if possible. I do like to help people get out of pain and restore their function, their mobility, and their health with using as much of a conservative approach as possible. So that is all I have that I just wanted to share on that. If you have any questions, please put them below. And if I don't have the answer, I will look into it and learn as much as I can about this. So if you are struggling with an ACL rupture, I am so sorry, and I wish you the best in your rehab and recovery. There is help out there. And one of the tools that I have developed is called the arthrokinematic restoration system. And that is to help restore the biomechanics and also the biophysiology of the knee or any in the joints of the body. So stay tuned for that, and I will share more on that in another video. Have a blessed day. Thank you.